Hi, and welcome to Checking In at SEA. My name is Perry Cooper. We are going to be talking about FlyHealthy at SEA and what we've been talking about with our consultants from the medical field about the things we need to think about as more and more people start to come to the airport and get prepared for trips that we probably haven't taken for quite a while. We're going to be working with a doctor who is from Harborview Medical Center and the University of Washington to help us with some questions. In this segment, what we're going to do is we're going to introduce you to one of our consultants and our specialists that we talk to for our FlyHealthy at SEA programs, Dr. John Lynch, who's with Harborview Medical Center as well as the University of Washington. First, Dr. Lynch, can you give us a little bit understanding of your background? Tell us what you do.
Yeah, sure thing. So, at the most basic level, what I am is an infectious diseases doctor. So my specialty is in infectious diseases, not only treatment, but also prevention. And what I work on, as really spending most of my time, is how to prevent infections from happening, in my case, mostly in hospitals and other healthcare facilities, but with the COVID-19 epidemic, starting to work with other facilities like Sea-Tac on how to make sure we keep these facilities as safe as possible while allowing some of our activities that are so important to us.
And you've been working with us for several months here as part of the program. We've already started back in May here with FlyHealthy at SEA. We're really proud of how that's going, but we want to continue to make sure that we're doing even better and getting these expert opinions on what we've been doing. As you mentioned, may not be something that folks in general have thought of in the past. What have you seen that's really important for a large public facility like we are here at the airport that you have to pay attention to that we may not have thought of in years past?
Well, I think the thing that's really encapsulates that is this idea of a layered approach. I think we've spent a lot of time focusing on one thing or another thing. It's just masks, it's just hand hygiene. For some places, it's just plastic barriers. And what we really understand is, for us who work in what's called infection prevention and control and industrial hygiene, is that it's the tried and true, which is that we need multiple layers. And so when we think about a traveler, for instance, coming through Sea-Tac, or we think someone going to the grocery store, it starts at when they leave their house, through the course of their travel, through the facility and on to their destination and then back. And what that means is we're looking for people to be healthy when they leave their facility, check in on them, their homes, check in how they feel. When they wear their masks, wear them appropriately above their nose and below their chin, right? As they move through the facility, keeping their hands clean, spacing out, right? It's very hard to put green dots everywhere in the world and say everyone has to be this distance apart. But so it relies upon some of our own judgment, create distance where we can, making sure we're eating away from other folks, particularly, or when we're unmasked, and then following kind of all the other rules and regulations that people are putting out there in terms of how to keep all of us safe.
And that layered approach, on the one hand, that helps us even if, say, one of those layers isn't super strict. So it's like a traveler doesn't have to be super paranoid.
Right. If
one of those elements isn't there, other elements are going to help protect you as well too.
Exactly. And so, the perfect circumstance to prevent any of this transmission of this disease is we all stay at home, right, and lock the door. But that's not possible. We need to be outside of our homes. We need to be engaged in all kinds of activities, not only to be well, right, to eat and drink and do our jobs, but also we're humans. We want to be part of a community that interacts and is active and sees each other. And so all of these things are mitigation tools. And just like you pointed out, yes, people can eat within Sea-Tac, distanced away, masked down, right, away from other people. And we have other things in place, that distance, ventilation, all that air handling that you don't even see, but you may feel when you come through the facility is critically important. We thought about hand hygiene early, back, about a year ago, as really being the most important thing, and it's still important. And surfaces as being a really important thing. I think actually for 2021, the focus is going to be on air. How we handle air, how we filter air, how we move air, ventilation, as sort of backing us up. When those masks come down, there's other pieces at play here to keep us safe.
And can you speak a little bit to, what we do just typically with air? And this is something we've done for years, and we've designed our new buildings and upgraded our older buildings to do that. It's about the way the air gets replaced with outside air, correct?
Yes, well, it's a combination. In any large commercial facility, it's a little different proportions, but what it ultimately is taking some fresh air and what's called some of recycled air. And the most important thing about the recycled air is that it gets filtered. And the air in Sea-Tac is being filtered with a very high level filter, so that when that air is returned into the facility and mixed with fresh air, it is not the type of air that's going to cause a problem for anyone.
Excellent. Well, Dr. Lynch, again, we appreciate this is just the first one of several checking in videos that we're going to have that's going to talk about our priorities and what we've been doing with Dr. Lynch and getting consultants for our FlyHealthy at SEA program. Stay tuned for more. We look forward to it, and thanks for checking in at SEA.